Well, I think the two most significant advances that we're seeing in cluster headache is one, a better understanding of the central mechanism by which cluster starts as a central parasympathetic disorder. The other, from a treatment point of view, it's kind of a return to the days of yesteryear, in that the role of histamine as a treatment is returning. There's a new histamine compound that's been developed in South America that has proven itself to be extremely reliable as a treatment in migraine headache and holds a great deal of promise for treating cluster headache, much as Baird Horton used 60 years ago as a therapy. The identifying cluster headache patients is one that sometimes is relatively straightforward. Cluster sufferers tend to be the tallest members in their family. They tend to have hazel eyes and deep vertical forehead creases, as well as ruddy complexions, facial telangiectasia, and they tend to have a relatively full head of hair despite advancing years. They also tend to be led into the office by their wife, who runs the conversation. John Graham, many years ago, called it the lion and the lamb syndrome. I think one of the most important things is the issue of differential diagnosis. Cluster headache sufferers all too often are confused with patients who have allergy or sinus problems. A couple of reasons for this is the timing of the cluster headaches, which oftentimes are spring and fall. And with the associated nasal symptoms of the rhinorrhea and nasal congestion that occur in cluster headaches, combined with the fact that some patients with cluster headaches will have at least a partial response to decongestant medications like pseudoephedrine, make it very confusing for the average practitioner, who only rarely in their practice might ever see a patient with cluster headache, which is less than 1% of the patient population.